Dear Medicos, welcome for the ENT segment. I will be discussing all the MCQs of the recent examination, and I am confident after giving your NEET examination, you must have realized the importance of revision, beta. And all interns, post-interns listening to me, let us take this session. Apart from taking all the MCQs of ENT, discussing the important concepts, I will be giving you a strong message कि बेटा need of R. What is the need of R? कि we should focus on the revision part बेटा. We have to concise our notes and we have to revise again and again. And it is one of the most crucial year of your life where you are preparing for the post-graduation. So let us focus more on the revision part and concising the topic. So let us start the session बेटा. The first MCQ. Very tricky question. ENT questions were straightforward, but some, you can say, some twist in the MCQ was there. A patient with suspected high frequency hearing loss. The first clue. I appreciate the ENT examiner who made these MCQs. I will be discussing with you 7-8 MCQs, and all these 8 MCQs, the examiner is giving some clue in each MCQ. High frequency hearing loss. If this word is there, so what we conclude? We conclude that the base of the cochlea is involved. If I take you in the basics of concepts of inner ear, we have learned there is a base, there is an apex, like your ball pen, there is a base, this is an apex. Base is high frequencies are involved, like 20,000 hertz, 18,000. So high frequency is examiner is giving you a clue that is base of the cochlea is involved. Clear? Then his examiner is giving you some extra fact that is due to the damage of the basilar membrane to confuse you beta. Examiner is giving a basilar membrane, whether it is apex or base. Obviously the organ of Corti which is present on the basilar membrane will be affected. Which of the following structure is expected to be involved which is closer to this segment? The examiner MCQ was which area is very close to this part or it is expected to be involved. So the answer is base of the cochlea beta. Base of the cochlea is very close to the medial wall of middle ear, that is your oval window, round window, promontory. So among these 4 options, the best option will be your oval window. Now just try to learn better. If I remove the word high frequency hearing loss and I say the patient basilar membrane is involved, which of the following structure is very close? So if the basilar membrane examiner is asking you, that is triavascularis is your lining of scala media, so it will be very close to the basilar membrane, agreed. But examiner is asking you the high frequency hearing loss, so the keyword it will be your base of the cochlea is involved, so better to go with the oval window. Modulus, not at all. What is modulus? Modulus is the axis on which the cochlea is coiled. Now if I go in the basic concepts, if this is my axis and the cell which is near to axis is inner, and cell which is away from the axis is your outer hair cell. Noise induced trauma, which cell is damaged? My outer hair cells are involved. So it will be not be close to modulus, it will be away from the modulus. So the answer D cannot be there. Am I understandable? Helicotrema is an area where your scala tympani fuse with the merge with the scala vestibuli. So again, this is one of not the right answers. Choice, the confusion was between B and C, and the better choice will be your C. Am I understandable? Because your high frequency hearing loss is there. Am I understandable? MCQ somewhere related with the inner ear, inner anatomy of the inner ear. So this image I have taken from the concept of your TAMS ENT book, where we have given this image a strong message that helicotrema is the area where both are fusing, nothing to do with your basilar membrane or base of the cochlea, while your oval window will be very close to the base of the cochlea. Coming to the next one, very favorite question of mine in ENT, identify the port. Many students were confused and I got many inbox messages, sir, at the last moment I jump on the malleus, it was in so it was made a big controversies among students. But just remember with a simple concept. In the anatomy of ear, middle ear, we have drawn such a nice beautiful image of malleus where we have drawn the head of the malleus. Am I understandable? And when we draw the incus, we draw short process of incus. If you have revise again the importance of revision, but here comes the importance of revision. When we were drawing the malleus, the first part I taught you was head of the malleus. Now beta, head of the malleus, so head will be convex surface. When I was teaching you incus, I was teaching you the short process of incus. There is some fossa which is important for facial recess, all about basics of your anatomy. So when we discuss the anatomy of incus, we always say this is short process of incus, which is again an important boundary of facial recess. So when I teach in my classroom like this, you touch your short process, you will feel some concavity. So what was the important point? How to differentiate? At MBBS level beta, you may be confused between malleus incus is but natural beta, but this surface was very flat surface. It was not like convex beta. Agar ye aisa hota, if it would be like this, I will be going in the favor of malleus. I hope you are getting my message. Answer was incus, incus, incus. No second thought. Clear? Yeah, this I am showing you. If the examiner show you something like this beta, basic concept should be clear. Is your head of malleus. I cannot be confidently say that this is which process, this is anterior process for malleus as a faculty, but you can be confuse it with some part of incus. But how will differentiate? Differentiate will be upper part will be flat beta, it will be flat. So this is your malleus, this is your incus, and this is your stapes, foot plate, suprastructure of the stapes. So if you concentrate on this part, but the answer will be going in the form of incus. Then will be long process of incus, that is a lenticular process of incus. Clear? So answer will be B option. Coming on the next one, I have given this image in my DAMS ENT book, where we have clearly mentioned that this is the head of malleus. With a focus your eyes, this is the head of the malleus. This is incus, the short process of incus. So they have shown you the flat surface. I have discussed with many students. The upper part was very flat. So answer will be going in favor of incus. Clear? Coming on the next one. Again, MCQ taken from your nasal polyps. Whenever I discuss the topic of nasal polyp beta, we discuss three important syndromes. The students who have revised the notes multiple times, they will agree with me that we discuss 3 points: Cartagena syndrome, Young syndrome, and Samson's triad. So what is Cartagena syndrome? Cartagena syndrome is something to do with the chronic rhinosinusitis, fasciitis inversus with bronchiectasis. That is Cartagena syndrome. And then again, one associated syndrome is there, Young syndrome, in which we are having azoospermia. Clear? But the examiner was asking you something on the last point which we discussed in the classroom was Samson's triad. What is Samson's triad? It is here sensitivity to allergy to sensitivity to aspirin. Very simple, one of the simplest MCQ. I will say this is one of the, we can't afford this question wrong beta. This is one of the easiest MCQ. Clear? So the patient is having here rhinosinusitis followed by patient will be having bronchial asthma, and the patient will be having sensitivity to a drug, that is your aspirin sensitivity. The right answer will be in this, among these choices will be D option. Clear? Coming on the next one. Yeah, again, I don't know why the students are having a debate over this MCQ. I have given the important concept. Even in my DVT, I have repeated this word multiple times: recurrent nasal bleeding. Better don't read the MCQ, go for angiofibroma. This was the key word given by the examiner. We can have a discussion of more than 2 hours on this MCQ, but if you want me to complete this question within 2 seconds, answer will be angiofibroma, recurrent nasal bleed. No debate should be there. Male in a second decade beta. This word was there. Many of the students were saying that it was 40-50-year-old male. No beta, it was second. Every student was saying second decade male having multiple nasal bleeding with recurrent nasal obstruction. Agreed. On endoscopy, the image was shown. This image, something like this image was shown to you. Now, examiner was giving you CT finding. In my lecture, I have shown you a CT examination, which they have given in form of words. Contrast enhanced CT reveal a large, ill-defined enhancing soft tissue mass. What the examiner is doing, wasting your time, filling the coin. Many students say enteroconal polyp. No beta, no. Enteroconal polyp is a question of recurrent epistaxis, recurrent bleeding. No way. So the word quinine, you are going for enteroconal polyp, not at all beta. Nasopharynx, bilateral nasal cavity. So this was the finding which we discussed in the classroom, a CT examination. The examiner, instead of giving CT, they have given you endoscopic image and the all finding given in CT, which is most appropriate diagnosis, no other than angiofibroma. Be confident beta, this is very crucial year of your PG preparation. Am I understandable? So it is better to focus on the gold standard class notes, revise them again and again, again and again. You can watch my DVT again. I have repeated this statement multiple times. Recurrent epistaxis, nasal bleed, angiofibroma, and the choice go in the favor of it. And I appreciate the examiner who confuse you by writing the word coina. The word coina doesn't mean it is enteroconal polyp. I hope you are getting my message. Answer will be B option. Let us crack all the other. Enteroconal polyp will be age 10 to 14 years beta. It is unilateral, yes, and there will be mass from the maxillary sinus going into the coina, middle meatus, enteroconal polyp. If it would happen enteroconal polyp, on CT examination, examiner must have given some finding of maxillary sinus. Which word will be going in the favor of your entroconal polyp. There is a soft tissue mass in antrum, maxillary sinus, filling the middle meatus, filling the ethmoidal infundibulum, filling the your hiatus seminoris. These what is hiatus seminoris? Ethmoidal infundibulum. These are the areas somewhere related with the middle meatus. So if examiner give you something related with the middle meatus, confined to the middle meatus and coina, we will be going in the favor of entroconal polyp. But the examiner here is giving you recurrent bleeding, second decade, we will be going in the favor of angiofibroma. Yeah, now coming on the next choices, mucormycosis. Obviously, the word diabetic have to be there in the MCQ, so I can rule out the option C. Yeah, mucormycosis cannot be there. Rhinosporiosis, again, they will be giving you a reddish mass, some mulberry-like polyp is coming out of the nasal cavity. The endoscopic view will be entirely different. This will not be like this polypodal mass coming in the nasal cavity. So it is here like mulberry-like polyp coming from the nasal cavity, will be going in the favor of rhinosporiosis. So answer will be the B option. Clear? Coming on the next one, I was expecting one MCQ on Bell's palsy, but I was expecting on the management part. But they have asked you the diagnosis, one of the simplest MCQ. But this was the simplest MCQ of your last examination. Answer will be year 7th now. Bell's palsy, the patient have a sudden onset. This word going in the favor of Bell's palsy, difficulty to open mouth, rolling of saliva, deviation of angle of mouth. All these are the simple options, simple choices given to you to make a diagnosis of facial nerve palsy. As for management part, always remember success rate is around 85%. If you give steroids, if you add a antiviral, acyclovir, within 72 hours, within 3 days, if you give your antiviral with steroid, the best success rate is there. Very favorite question of your NEET examiner, they will give you the patient is coming on the 9th day. Irrespective of the day, irrespective of the presentation, we always give acyclovir. Just remember the golden rule. But if you give within first 3 days, best success rate will be there. Patient, 85% of the patient respond within 3 weeks. And what is a golden rule we have to memorize for our upcoming INICET examination? A patient is not responding within 3 weeks, it means he is not a idiopathic. We have to go for the cause. We search the cause with the help of electrophysiological testing. We go search the cause with electrophysiological testing, and if the patient is having some evidence of nerve degeneration, if the patient is having any evidence of nerve degeneration, we'll go for surgical decompression. And if the nerve are normal, we repeat the same treatment for 3 weeks. So this is a simple part of management of Bell's palsy. Coming on the next one, question number 6. A adult male while having a dinner suddenly become aphonic, choking sensation. Amandus patient was having respiratory distress. Which of the following should be the emergency conditions? So what we have to do, the very simple one of the straightforward MCQ. Again, Heimlich maneuver, we have to try our best to remove this foreign body. Amandus the food bolus. This is a often encountered scenario where the patient is having dinner or lunch and the patient is having dyspnea, immediate dyspnea. Why? Because the food bolus went into the respiratory tract. So what is the first step we have to do? Heimlich maneuver, where we are pushing just below the rib cage to dislodge this foreign body. Amandus are you getting this point? Remove the foreign body by finger blindly, the biggest blunder. The option ruled out, we never do this. The option A and C, again confusive choices, chest thrust or back slap. Just remember this point, among chest thrust will be giving the results will not be as good as like we are having in Heimlich maneuver. Amandus maneuver, back slap, sometimes it aggravates the scenario, sometimes it forces the foreign body deep into the lungs, so it is not advisable. Again, answer will be your D option. Clear? Answer will, the best option will be D option. Clear? Coming on the question number 7, a 6-year-old child brought by the mother with a history of hearing loss. Very important point, very important. I'm saying many students were having a confusion over this MCQ. The choices were serous otitis media, meningitis bullosa, that is your otitis externa hemorrhagica, the name of meningitis bullosa, pneumotympanium, and CSM. I can rule out CSM. The patient is not giving any history of ear discharge, neither the perforation is seen. So answer will be either A, B, C. If I go with the A, B, C, pneumotympanium options is not having this type of finding. But if there is pneumotympanium, there will be a bulge of the tympanic membrane. It will be a severely bulging tympanic membrane. Again, I can rule out the option C. The option A and B, very close choices. Now, what is the keyword, beta? Now, anyone who can write in the chat box, beta? What should be the keyword? You tell me. Painful swellings, painful blebs, painful vesicles over the tympanic membrane, going in the favor of meningitis bullosa. But examiner is giving you a keyword of hearing loss. If hearing loss is there for the last 2 months, they're going in the favor of ET tube dysfunction, going in the favor of serous otitis media. I hope you're getting my message. Painful blebs is equal to meningitis bullosa. Hearing loss with multiple ear swellings with air fluid level, all will be going in the favor of serous otitis media. Clear? Answer will be serous otitis media. If the examiner show you this slide and ask you the management part, the management will be your myringotomy. Myringotomy where anterior inferior, grommet where anterior inferior. So these are the two important expected MCQs in the upcoming INICET examination. Myringotomy with grommet, and after how many months we go for grommet? After 3 months of treatment failure. Very important MCQ. Clear? Now I want to give you one important statement. The most cases of meningitis bullosa, they are somewhere between the age of 2 to 8 years, while ASM is typically seen in the less than 2 years. Again, exceptions are there. Serous otitis media can be seen beyond the age of 2 years. First point, important concept. This important statement, if I apply the age of the patient, will be going in the favor of meningitis bullosa. Even then, because painful blebs, painful swelling not mentioned, answer will be serous otitis media. Age distribution, as far if you go with the age, it is option B is a better choice, but answer serous otitis media because the patient is having hearing loss. No pain word is mentioned in the MCQ, so answer will be A option. Coming on the last one, post-COVID patient. COVID patient, what is the golden rule I discussed in my classroom? Beta, ear, malignant otitis externa, nose mucormycosis, and oral cavity will be a Ludwig abscess. Am I understandable? So answer will be a B option. Next point, what will be the drug of choice? Drug of choice will be your liposomal amphotericin B. Clear? So these were the 8 important topics which they have tried. MCQs were straightforward, but yes, again they focus more on the important concept, keywords like hearing loss, no pain. We will be going in the favor of serous otitis media, not meningitis bullosa. If we compare the serous otitis media against meningitis bullosa, beta, patient of serous otitis media may have pain, but the pain will be a prominent symptom. Painful blebs will be mentioned in MCQ, then only will be going for meningitis bullosa, beta. What we have learned from last NEET examination, beta, we are playing a game where 19 subjects are there, beta. Just try to learn all the interns, post-intern listening to me. If there would have been 1 or 2 subjects, we can go in the detail, we can do deep analysis of each and every subject, but we have 19 subjects, beta. This is a time bound game, beta. Just remember this point, because the 1 year 19 subjects have to be done. Whatever you people are doing, just remember one thing: concise, revise again and again, beta. Am I understandable? Clear? And next 1 year, before going for the next NEET examination or INICET examination, just focus on the revision part. Don't run behind the quantity, beta. It's a high time to realize the importance of concise notes, importance of revision. So make a promise in the chat box, beta. We people will concise our notes and we will revise them multiple times, beta. I'm understandable. This NEET have proved that we have to revise again and again. Any queries you can ask me in the exclusive club, DAMS exclusive club. You can ask me in the Telegram group, Dr. Deepak ENT, or you can ask me in the exclusive club, DAMS exclusive club 2022. Clear? Thanks a lot for listening to me. Very best wishes, beta, and just prepare hard for upcoming INICET examination. Clear? And if you can't perform well in this examination, beta, no guilt should be there. but make a promise, try your best to work hard in the upcoming days, beta. Clear? Last 1 year if you couldn't study, your NEET performance was not up to the mark. No issues, beta, no worries, but we should not spoil the next 1 year. Clear? So it is better to just focus on the conceptual learning. Best wishes. Thanks a lot.